If you've ever seen someone after Botox or fillers and thought, something looks off, this video is for you. Great aesthetic results don't come from chasing lines or wrinkles. They come from understanding anatomy. I'm Dr. Fred Bloem. I practice integrative and regenerative aesthetics. Today I want to explain the principles behind natural, balanced toxin and filler treatments. Not brand names, not trends, the why behind good outcomes. If this kind of education is helpful, like the video, subscribe, and consider joining my newsletter. I focus on education, not hype. Anatomy gives you freedom. When a provider doesn't fully understand anatomy, they rely on grids, maps, and one-size-fits-all algorithms. They may feel safe, but it limits precision. When you truly understand anatomy, you can customize treatments, adapt to different faces, and reproduce results consistently. Every face is different. Anatomy lets you treat people, not patterns. Most patients come in saying, I just want my forehead lines gone. That's reasonable. But as a physician, my real question is different. What will happen to your eyebrows if I weaken your frontalis muscle? Here's something many people don't realize. The eyebrow is not attached to bone. It floats. It glides on a balance of muscles. You have one elevator, that's the frontalis muscle. You have several depressors. Corrugator, procerus, orbicularis, and gravity works against you. If you weaken the only elevator without respecting that balance, eyebrows drop. That's when people look tired, heavy, or older, even with smooth skin. That is why Botox is not really about wrinkles. It's about eyebrow positioning. Another important principle. All toxins block neuromuscular transmission, but they don't behave the same. Some toxins diffuse more. They affect broader muscle areas. Others are more precise. They stay closer to where they are placed. That matters because the forehead often needs diffusion. The glabella often needs precision. Using the wrong toxin in the wrong place can cause drop medial brows, over-elevated lateral brows, or unnatural expressions. Same logic as fillers. You wouldn't use a soft filler for cheek structure. You wouldn't use a firm filler for lips. Wrong tool. Here's one of the most important principles I teach. Don't chase wrinkles. Chase muscles. Wrinkles are symptoms. Muscle movement is the cause. If you treat lines without understanding muscles, results are unpredictable. The angry look, for example, involves three muscles: the procerus, the corrugator, the orbicularis oculi. If you understand where these muscles originate, how deep they sit, and how they interact, you can treat predictably and safely. Now let's talk about fillers. Fillers work because the face is three-dimensional. The face is not just skin with a random mix of fat and muscle underneath. It's layered. Skin, superficial fat, muscle, deep fat, ligaments, bone. Each layer behaves differently. Each layer has different safety considerations. Each layer affects how the face moves. Injecting in the wrong plane doesn't just increase risk, it changes facial movement. Another key principle, when you treat the upper face well, you often improve the mid-face. Facial layers are connected. This is why isolated overfilling leads to puffiness, heaviness, and facial overfill syndrome. Natural results come from respecting structure, not adding volume everywhere. This is why I'm very deliberate about product choice, injection depth, and treatment sequence. Aesthetic medicine isn't about syringes, it's applied anatomy. Anyone can inject. Not everyone understands long-term consequences. If you're considering Botox or fillers, ask your provider, how do you think about eyebrow balance? How do you choose products for different areas? How do you avoid overfilling? If those answers are vague, that matters. If you want thoughtful, anatomy-driven aesthetics, that's exactly how we practice. Like the video, subscribe, join my newsletter, and if you'd like a consultation, we're happy to help.